Good evening to the Codman Square community. My name is Cynthia Loesch-Johnson, and I'm president of the Codman Square Neighborhood Council. Thank you for joining us for our annual Health of Codman Square meeting. We have lots to cover during this meeting, and as you are aware, we reserve this meeting every year to collaborate with our friends over at the Boston Public Health Commission to review the health of the Codman Square community as it compares to the city of Boston. Past annual meetings have included review of our overall health, looking at fair housing, looking at mental health, things like that. But tonight, you will hear from the Boston Public Health Commission regarding COVID-19 data specific to our community, and we'll also hear from the Boston Licensing Board, the Boston Tobacco Control Program, and others. Of course, you will also be hearing from numerous community residents sharing efforts that are happening in Codman Square to improve the health of the community. But before any of that, we do have a few words from Mayor Walsh. So without further ado, let's share those remarks.
Hello everyone, Marty Walsh here. Thank you, Cynthia. And thank you to the Codman Square community for all of your hard work and support and patience during these past few months. Thank you for hosting the annual Health of Codman Square meeting with the Boston Public Health Commission. This event shows the importance of collaboration between the city and community leaders. Coronavirus continues to be one of our biggest and toughest challenges in our city's history. It's required an all-hands-on-deck approach from leaders and workers in healthcare to first responders and frontline workers, government and nonprofit, and our residents. It's been all difficult work, but I could not be more proud of how our city has risen to the challenge. At the core of our response, strategy is how we protect our most vulnerable communities and how we make sure equity informs all of our work. Since the beginning of this crisis, we have focused our outreach and resources on our communities where inequities are evident, in the case of numbers, test results, and risk factors. Our Health and Equities Task Force is guiding this work. We have been a leader in collecting and sharing data. We've expanded access to testing in the hardest hit communities, and I want to thank the Codman Square Health Center for all of the hard work in that. We're doing target outreach in multiple languages to make sure everyone has the most updated information. Our efforts so far are working because we acted fast, we acted early in our response to this virus. The only way we can continue to move forward is to keep all of this hard work going. We all have a role to play in protecting the health and safety of our city. I know it's been tough for everyone, but there's a light at the end of the tunnel, and we will beat this, and we will come out on the other side as a stronger and more resilient city.
Without further delay, I would like to introduce Leslie Salas Karnes, Division Director of Education and Community Engagement, Infectious Disease Bureau of the Boston Public Health Commission.
Thank you, Cynthia, and thank you all for inviting me here. It's a pleasure to talk to the Codman Square community. We're going to share data on the cases that we're seeing in Boston. Additionally, we will be discussing preventive actions that people need to take to protect themselves and those around you. And so let's just get started. So the 2019, the COVID-19 is a respiratory disease caused by the SARS-CoV-2 virus, formerly known as the 2019 nCoV. It mainly spreads from an infected person to another through respiratory droplets. When an infected person coughs, talks, or sneezes on someone who is within 6 feet, COVID-19 can also live on surfaces and objects. Depending on the material of the surface or the object, the virus can stay alive for a couple of hours to up to 3 days. Thus, it is very important that a person that touches a surface or object that may potentially have the virus, that they wash their hands frequently, because they can introduce it into their body when they place that same hand into their mouth, nose, or their eyes. That is why it's important to regularly clean and disinfect areas that are frequently touched, such as tables and doorknobs. People with COVID-19 have had a wide range of symptoms, ranging from mild symptoms to severe illness. The symptoms may appear 2 to 14 days after exposure and include fever, cough, shortness of breath, or difficulty breathing, chills, muscle pains, headaches, sore throat, and a new loss of taste or smell. This list is not all the possible symptoms that people could have, and we're continuously updating it. If you develop emergency warning signs such as trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face, you need to seek medical attention right away. Anyone can get COVID-19. However, there are individuals that are higher risk for complications. Older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications. People with moderate to severe asthma may be at higher risk of getting very sick from COVID-19 because it can affect their respiratory tract, cause an asthma attack, and possibly lead to pneumonia and acute respiratory disease. That is why it's especially important for people in these groups to protect themselves from exposure. Although the first case of COVID-19 were first reported in China, there are now cases throughout the entire world. As of August 3rd, 2020, there had been over 18 million cases of COVID-19 reported all around the world. There have been 4,668,000 cases of COVID-19 reported in the United States, and the numbers continue to increase. In Boston, we have taken several steps to slow the spread of COVID-19. As all of you are well aware, schools, colleges, and universities were closed for in-person classes, and they started offering online instructions. Events, including sporting events, festivals, and parades were also canceled or postponed. Workplaces were encouraged to offer flexible work options such as telecommuting. Organizations and businesses also canceled large events such as conferences, and houses of worship suspended services. The stay-at-home advisory implemented in Boston was another step that we used to help reduce the spread of infection amongst the community. Social distancing, which really should be called physical distancing, is a public health practice that aims to prevent sick people from coming in close contact with healthy people. This is another tool that we are using to help control the spread of infection. People are asked to remain out of congregate settings around mass gatherings, maintain distance approximately 6 feet from others. We're asking people to physically separate themselves. People are still encouraged to keep social connections with friends, family, and others via social media, phones, or other virtual methods. Humans are social beings, and we need that constant contact. The goals of social, also known as physical distancing, is to reduce opportunities for disease transmission, to reduce the chance of infection among high-risk populations, and to reduce the burden of healthcare systems and workers. Another public health term that has been used often is flattening the curve. Flattening the curve is the idea of slowing the spread of a virus so that fewer people need to seek treatment at any given time. Thus, reduce the number of people who are sick from COVID-19 at the same time so that we have enough resources in the healthcare community to take care of everyone that needs it. This is why so many countries have implemented social distancing guidelines. This is a graphic representation of why flattening the curve is important. The shaded curve demonstrates the high number of cases that we would see in a short period of time if no interventions had been implemented. The second curve shows that there would be a decreased number of cases over a period of time, thus reducing the peak number of cases and related demands on hospitals and other infrastructures, reduce the number of overall cases and health effects if an intervention such as social distancing is implemented. So now let's look at the numbers of COVID-19 cases in Boston. As of July 31st, there had been 14,138 COVID-19 cases reported. Of cases where race and ethnicity is known, 4% were Asian, 30% were Black, 28% were Latino or Hispanic, 25% were white, and 8% were considered as other. Out of all the cases with COVID-19 reported, we have had, unfortunately, 730 related deaths. The breakdown of these cases by race and ethnicity are 7% Asian, 35% Black, 11% were Latinx, Latino, or Hispanic, 44% were white, and 3% were identified as other. Here's a map of how many cases of COVID-19 are reported throughout the city of Boston. The incidence rate of COVID-19 was higher in Dorchester, East Boston, Hyde Park, Mattapan, Rossendale, Roxbury, and the South End when compared with the rest of Boston. In Boston, we were able to flatten the curve thanks to residents and businesses following the public health guidelines of practicing social distancing, wearing face coverings, and frequent hand washing. Our numbers of new COVID-19 cases have decreased, and the city determined that we could reopen, but we need to do this safely. Thus, in Boston, we're using 3 public health metrics to help us assess the situation in Boston. And these include metric 1, which is looking at the daily number of positive tests. So here we're looking at the number of new positive tests that we are seeing each day. The baseline average of positive tests for Boston residents daily is 21.4. And our threshold that we will show a significant increase from this baseline is 36.2 daily positive tests based on the 7-day I'm sorry, I couldn't read my notes, trailing moving average. So what that essentially means that if our daily number of positive tests reach higher than 36.2, we may need to take extra actions. For metric 2, daily percent of tests that are positive, we're looking at the rate of positive tests seen from all the COVID-19 tests each day. The baseline average of positive test rate for Boston residents using data from June 10th through July was 2.1%. Our threshold that will show a significant increase from this baseline is a positive test rate of 4.0% based on the 7-day trailing moving average. So what that means again, if our daily percent of tests reaches higher than 4.0%, we will need to take action. Metric 3 is the daily new COVID-19 hospital admissions. And here we're looking at new COVID-19 admissions to hospitals each day. The baseline average of new hospital admissions to Boston hospitals using data from June 10th through July 11th was 105.3. And our threshold that will show a significant increase from this baseline is 131.9 new admissions based on the 7-day trailing moving average. So let's look at where we're at right now. For metric 1, the daily number of positive tests, as you can see here, as of July 21st, we had the daily positive tests was 22.1, which is well below the 36.2 positive tests that we would need to take additional actions. And the prior 7-day positive test was 26.7, which shows that we're moving into a positive trend. The next slide talks about metric 2, the daily percent of tests that are positive. As of July 25th, the positive test rate based on the 7-day trailing moving average was 1.7%. Again, well below the 4% that would require us to take action. The prior 7 days had been 2.5% positive test rate, which again shows that we are moving towards a positive trend. Additionally, over the most recent week for which there's a complete data, so that's from July 15th through July 21st, there were 6,802 tests with an average of 972 per day in Boston. The prior week had 8,479 tests with an average of 1,211. So we are seeing that people are not taking the test as often, but again, it shows well that our percentage of tests that are positive is decreasing. So for metric 3, the daily new COVID-19 hospital admissions, the status as of, again, July 21st, there were 92.9 new COVID-19 hospital admissions based on the 7-day trailing moving average. The prior 7 days had 105.0 new hospital admissions. So again, it's moving towards a positive trend. In order for people to prevent acquiring and spreading COVID-19, everyone is asked to continue to wash their hands often with soap and water for at least 20 seconds and use alcohol-based hand sanitizer. Avoid touching their eyes, nose, and mouth with unwashed hands. Avoid the virus by avoiding close contact with sick people. For people who are sick, they should also be staying home, and everyone should cover their cough or their sneeze. This is important since people may have COVID-19 and have no symptoms. And that is one of the reasons why we're encouraging everyone to use face coverings when they're outside and they cannot maintain that 6 feet distance. People should also not share drinks, food, or eating utensils with others, and frequently touch objects and surfaces should be cleaned and disinfected frequently. It is important to remember that COVID-19, it continues to circulate in the community. In general, the more closely you interact with others and the longer that interaction is, the higher risk of COVID-19 will spread. If you decide to engage in public activities, continue to protect yourself by practicing everyday preventive actions and keep these items on hand when venturing out. Again, using a cloth face covering, tissues, and a hand sanitizer that has at least 60% alcohol if possible. If you think you've been exposed to COVID-19 or develop COVID-19 symptoms, and again, they could be fever, cough, difficulty breathing, but they could be additional ones like the ones I mentioned earlier, you should talk to your healthcare provider. Healthcare providers will get detailed medical and contact history from patients, and then they will determine if you need to be tested for COVID-19. People who feel sick, again, with COVID-19 symptoms, it's important for them to get tested. Healthcare workers in contact with patients or other healthcare workers and first responders, such as EMS, fire, police, they also need to be tested. And anyone who has close contact with people that have been diagnosed with COVID-19, even if they don't have any symptoms, they should also be tested for COVID-19. As many of you are aware, testing sites are available throughout the city of Boston, which is very important for us to make it accessible to all our residents. And again, it is important to know that although they're free, you should always call ahead before heading to one of the sites. The hours of operations vary, and many offer assistance in multiple languages. For more information, visit the BPHC website for the latest testing site list. People who suspect or have COVID-19, they need to stay at home. to prevent the spread of the infection onto others. The only exception is if they need to go get medical care. It's also important for them to separate themselves from other people. This is known as home isolation. If they need to get, they need to call ahead if they need to go to get medical care so that the doctors or the clinics would be ready for them. They need to wear face masks if they're sick, and they need to be avoid being near others. They also need to cover their coughs and sneezes, clean their hands often, avoid sharing personal household items, clean all high-touch surfaces often, and it's important for them to monitor their symptoms. There are two terms that have been used interchangeably, and I want to clarify the difference between the two, and that's between isolation versus quarantine. Isolation is used to separate ill persons who have a communicable disease from those who are healthy. People diagnosed with COVID-19 will need to isolate themselves from others until they're no longer infectious. Quarantine is used to separate and restrict the movement of someone who may not have any symptoms, who feels well, but has been exposed to someone with the disease, and they need to determine whether or not they will be developing them. People exposed to COVID-19, close contacts, or if you travel to an area with high rates of COVID-19, must quarantine for 14 days after the last day of exposure. There are two strategies to use to determine if someone can end their isolation period: test-based and symptoms-based strategy. Test-based strategy requires for individuals to be fever and symptom-free and have 2 negative test results. This strategy is not recommended by the CDC for all cases, since many people may continue to test positive, and it doesn't necessarily mean that they are contagious. Symptoms-based strategy requires the individual to have no fever for at least 24 hours without the use of fever-reducing medication, and other symptoms need to have improved, and at least 10 days should have passed since the symptoms started. However, for people with severe to critical illness, or if they had compromised immune system, they will need to be symptom-free for 20 days. Keep in mind that the decision to end someone's isolation period will be taken by a public health professional. I just wanted, before I end this presentation, I wanted to share that BPHC has created many educational materials available on our website and available in multiple languages. There are, and again, they could be fact sheets, we have a frequently asked questions, and we have guidelines that everyone is welcome to use. Additionally, the City of Boston also has various resources available to residents. So I encourage everyone to visit the City of Boston website at www.boston.gov, where you may find resources that can help you and your family overcome everything that's going on during the COVID-19 crisis. Thank you.
Thank you very much, Leslie, for your presentation. We appreciate it. We have a question here. We know that long-standing systemic health and social inequities have put Black families at increased risk of getting sick and dying from COVID-19. Seeing the number of incidences in Dorchester, and specifically among Black families, reaffirms this. In your opinion, what can be done to address the differential impact on Black communities in Dorchester?
That's a great question, and it's something that we've been working hard. And it's not a decision or an answer that's going to come from us. It has to come from the community. So we've been really connecting with local partners to help us address the situation. We need to, again, like you said, there's a lot of inequities. So are people not able to get the health care that they need in their areas? So we need to, again, make sure that that's available for everyone. We need to make sure that everyone knows what symptoms require immediate attention. And again, educating the public about what steps they can take to protect themselves is important. So in this, from the Boston Public Health Commission in the City of Boston, we're working very closely with local partners to ensure that we're addressing these.
Thank you. Excellent. Leslie, I'm glad you mentioned working with the community. So let's hear from the Codman Square community on what can be done and what we're doing. I would like to introduce Joanna Edwards of the Codman Square Neighborhood Council to share an assessment taken by the Codman Square Neighborhood Council to better understand the options available to us on our main streets.
I'm sorry. Good evening to the Codman Square neighborhood community. Thank you, Cynthia, because I was going on a rant just now and no one could hear me. So good evening to the Codman Square community. I have just shared my screen to display the Codman Square neighborhood that we're in right now in terms of the merchants that are existing in the community. And the point that I wanted to make here is that, you know, we've asked the community what types of businesses and merchants they'd like to see. And then what was mentioned is that some of the establishments that a lot of people were interested in were bookstores, flower shops, pet stores, baby gym, fun for children, youth daycares, ice cream shops, theaters, sit-down restaurants, and healthy food options. And as you can take a look here and see, we have an excess of beauty nail salons, fast food restaurants, and just if you just take a look here, just looking at the beauty and hair nail salons all alone, is 27 of those in our community. Scrolling down, looking at the screen here, in churches and other religious establishments, convenience stores, restaurants, 17 restaurants within the community. As you can see, we have a KFC, we have a China Station, we have Oriental House, Popeyes, which was built and not licensed, McDonald's, and the list goes on, just to kind of give you a purview in terms of what's already existing in the neighborhood. And what we want to do is just change the narrative in terms of being the change we want to see. If we want to see healthier options in our community, we as a community need to be vocal and start advocating for the places that we want to see. If we know of any landlords that have any vacant establishments in our community, and we know individuals or businesses who want to come into our establishments that share what we would want to see in a community, try to be vocal and express that to the landlords of those establishments and advocating for those individuals who want to come into the community. And just scrolling down so you can continue to see the establishments that are currently within our neighborhoods, laundromats, and other businesses. And so I'm just going to continue to scroll down for you all to see. And I believe Cynthia has shared this with the community before when we've had past discussions about other establishments coming into our community, for example, Popeyes, and I think it was the marijuana dispensary that was trying to come into our neighborhoods as well. And I think that what we reflect is what attracts other people. So if other organizations see that we are consistently allowing fast food restaurants, nail salons, and other things that we don't want to see in our community, they're going to continue to target our community and try to advocate for these types of businesses and establishments to be in our community. And so if we want to start changing the conversation and changing the narrative, let's start advocating for other establishments that are reflective of what we've assessed and asked the community in terms of what they wanted to see. And I will repeat what those establishments were. Again, they were bookstores, flower shops, pet stores, baby gym, fun for children, daycares, ice cream shops, theaters, and sit-down restaurants with healthy food options. And so I believe this can be shared again for anyone who was curious to know what was in our communities. But as you can see at the bottom, what is missing? Where is the leakage? What do you leave Codman Square to do, or where do you spend your money? Where do you go to have a meal with your family? What do you shop for outside of Codman Square? And where do you grab a cup of tea or coffee? What else do you want to see in our community? Residents' comments includes bookstores, flower shops, pet stores, as I mentioned before. And so this is just a great breakdown that was put together of what is currently existing in our community, what we already have, what we're oversaturated with, and we want to start changing what's in our community and start advocating for healthier options for our residents.
Recording. Thank you, Joanna, for your presentation and for your leadership with the Codman Square Neighborhood Council. This information presented in this way paints a clear picture. It's no wonder our community has the health inequities that we've been learning about. It's no wonder why COVID-19 is disproportionately impacting our community, and we have numerous pre-existing conditions from diabetes type 2, heart disease, high blood pressure, things like that. So we need to change the makeup of our merchants district. We need access to healthier options in our community, and it sounds like residents want this as well. So I invite you to join us in our efforts to showcase what the community wants to change in the neighborhood. We will be surveying residents to tell us more about the different options they want to see in the community, and really just figure out how do we bring in those establishments? How do we get a decent cup of tea in our community, a place to sit down with our family and eat a healthy food option. And so I appreciate your leadership, Joanna, and we will figure this out together and with everyone on this meeting. We will now hear from the director of the Boston Tobacco Control Program and learn more about tobacco policy efforts in the city and in our neighborhood. Let me just make her a host. Let's hear from Nikysha Harding.
Good evening, Codman Square community. My name is Nikysha Harding, and I direct the Tobacco Prevention and Control Program at the Boston Public Health Commission. So my program consists of myself, one administrative assistant. We have 3 full-time compliance officers, as well as a host of undercover youth agents who are the ones that are going in the stores to see if the retailers will sell them tobacco products. There we go. So just looking at some of the programming that we do, we offer technical assistance to landlords that are wanting to convert their residential properties into smoke-free housing. We also offer lots of cessation support and capacity. So we sponsor and we've trained over 140 clinicians and community members to provide cessation counseling. We're currently in the midst of one of those trainings right now. I believe we have about a dozen or so residents who are taking online classes to be able to offer cessation training. We also do have some limited capacity to offer cessation groups. And so we do a lot of those like at BHA housing, as well as some elderly housing. One of the large portions of the work that we do is really looking at tobacco regulations. And so we are responsible for both the implementation and the enforcement of laws regarding both selling and using tobacco. And so the 3 compliance officers that I just mentioned, they're the ones that are responsible for educating not just our retailers, but different workplace owners, as well as making sure that they are in compliance. So they go into all of the stores that sell tobacco products to make sure that they have all of the required signs, to make sure that their products are placed and priced properly. And lastly, we also hire underage youth to go into the stores to attempt to purchase tobacco products. So currently we have about 790 retailers that are located within the city of Boston that are permitted to sell tobacco products. This number has really decreased since I began tobacco back in 2005. When I began, we had over 1,200 retailers that were selling tobacco citywide. So right now we're down to about 790. And this 790 is actually down from about 850 last year at this time. So we're definitely seeing that the trend is heading in the right direction. Of those 790, about 50 of them are what we call adult-only stores, what you guys may know as to be smoke shops. So just taking a closer look at the Codman Square area, currently of the 790 stores that are located in the city of Boston that are permitted to sell tobacco, 51 of those stores are located within the 02124 zip code. And of those 51, 2 of them are the adult-only stores or the smoke shops. Specifically, the name of them is actually 2 of them It's called 21 Plus. And there are 7 liquor stores within 02124 that are permitted to sell tobacco products. So just looking at the history of tobacco control within the city of Boston. So I began working in tobacco control in 2005. And when I began, it was really Cynthia and the youth advocates of Bold Teens that really gave me my introduction to tobacco control. They were really instrumental, to me, and they continue to be the experts in tobacco control. So we definitely lean on them a lot. So in 2003, we were one of the first in the nation to become smoke-free. In 2008, we began prohibiting the sale of blunt wraps, as well as taking a closer look at some industries or some places where we were still seeing smoking and still seeing employees being affected by the perils of secondhand smoke. So that includes hotels. So at that time, we no longer allowed hotels to offer smoking rooms. In addition, we also looked at outdoor patios as well as construction sites where workers were still being exposed to smoke. So since then, we also don't allow smoking on patios as well as construction sites, even if they don't have their walls up. In 2011, we started seeing just an influx of electronic cigarettes in the market. And so we really started treating electronic cigarettes, or as we call them, nicotine delivery products. We started treating them the same way that we treat tobacco products. We have to be of a certain age, as well as you cannot use electronic cigarettes any place where tobacco products are not allowed to be used. So a couple of years later, in 2015, we raised the age to purchase tobacco products from 18 to 21. In addition to that, we also really started looking at specific products, such as flavored tobacco products. And so what we know is that when youth begin starting to smoke, 9 times out of 10, they're using a flavored tobacco product. And so at that time in 2015, we restricted retailers from selling flavored tobacco products. So these are like the fruity or the alcohol flavored cigars and cigarettes and electronic cigarettes. And we basically pushed all of the flavored tobacco and nicotine delivery products into the adult only stores. At that time in 2015, the guidelines that we had for the adult only or the smoke shops, as you may know them, is that 90% of more of their sales had to be from tobacco, nicotine, or tobacco and nicotine paraphernalia. So this means they cannot sell food, no lottery. The real intent and purpose of these stores is to be able to sell tobacco and nicotine. So other things that they were selling were t-shirts and CBD, grinders, and different things like that. So just looking at, so we've done a lot in tobacco control, and oftentimes people think, where our work is really done. But, lately we've just been looking at specific populations that we know are still disproportionately affected by tobacco. And so what we know is that Black adults, their smoking rates tend to be really high. Of the Black smokers, 9 out of 10 of them prefer menthol cigarettes, and the quit attempts are not as successful as they are for white residents. And so this was back in November of last year, we, with the help of the Codman Square Neighborhood Association, we really tried to engage the community about menthol and vaping products. And so at the Great Hall, there was a really great event that was held where there were a ton of different youth advocates and community members, smokers. There were a bunch of people there that were really there to, to hear about and to voice their opinion about what they were seeing in their communities regarding menthol use and vaping use. So most recently in 2019, so this just happened just in November, I have to say this was definitely our most comprehensive and stringent amendments that we've had yet. So a couple of changes, and these are, changes that I think are really going to have some real lasting effects on, just the tobacco within our city and our state. So a couple of things that we did when we changed the law was that before, if someone went to ask for a tobacco product, if the person looked under the age of 27, you had to ask for an ID. And so what we were seeing is when we were sending in our youth, who sometimes, might have a little bit of facial hair or may, be a little bit more stocky. Oftentimes the retailers, they'll complain, well, the person looked like, they were 25 or they looked like they were this age. So we amended the regulation to kind of just get rid of that excuse. So now anytime anyone wants to purchase a tobacco product, regardless of what their apparent age is, they have to be ID'd. The other thing that we did was taking a closer look at adult-only stores. So before we said that 90% of their products had to be tobacco or nicotine products, now it's 100%. Just because just enforcing that, it just became an enforcement nightmare trying to figure out whether or not they really did meet that 90% standard. The other thing that we did not do in 2015, when we told all the stores that they could no longer sell flavored tobacco products, we did not include menthol products. So a couple of years later in 2019, we did include menthol in that definition of flavored tobacco products. And so this is something that should have been done in 2015. It wasn't, and so we did correct it. As a result of this specific amendment, and the Massachusetts regulations, they also amended their regulations shortly after we did ours. As a result, flavored tobacco products, including menthol, so that's Newport cigarettes, can only be sold at smoking bars. And currently, we only have 4 smoking bars located in the city. We won't allow any more to come in. And actually, that's 4, that's down from about 12 in 2008. So we're definitely, again, heading in the right direction. The other thing that these regulation amendments did was looking at flavor enhancers. So as you know, the tobacco industry is very savvy. When we tell them they can't sell, tobacco products, they start coming out with flavored tobacco products. They come out with flavor enhancers. So these are different sprays or rolling papers or even hookah tips that will add flavor to tobacco products, since we, no longer allow that. And the last thing that we did was looking at vaping products. And so basically restricting the sale of those products to only the adult-only stores and smoking bars within the city of Boston. So just looking at our enforcement and education during these COVID times, while we may not be able to be out in the stores as much as we would like right now, we are really doing a lot just to do, and a lot of education, and because these regulations are very complex, when you combine the Boston regulations with the new Massachusetts regulations, it could be very confusing. For instance, just last Friday, myself and my staff, we visited a lucky or not so lucky, this was an adult-only store that was located in Fields Corner, and we literally spent more than 3 hours in this store going through literally every single product that they had in the store, just to make sure that we as a staff were on the same page as to what is allowed and what isn't allowed, and in what circumstances they're allowed and when they're not. So since passing these regulations, we've been sending mailings out to all of our retailers. We are finalizing a video that we'll be posting on our website and putting on some of our social media pages, detailing regulations and expectations. In addition to that, we've also have started doing some in-person visits as well as phone calls. So we were in the midst of doing a full round of in-person education when COVID kind of put things to a halt. But since then, all of the stores that we did not get to do an in-person visit, we have been doing phone calls with them. So the last thing that I would like to leave you with is an incentive program that's actually being sponsored by the Massachusetts Tobacco Control Program. So this incentive program is specifically for menthol smokers. And so if you're a menthol smoker interested in quitting or just willing to try to make a quit attempt, they can call the quit line, which is 1-800-QUIT-NOW. In the first phone call, they'll receive a $10 gift card. After the second call, they will receive, I believe, $15. In the third call, they'll receive $25. In addition to the gift cards that they receive, they will also receive up to 8 weeks free of the patch. So it's a really, really great, a great program and a great incentive program that, that we're hoping that residents will really take advantage of.
Great. Thank you so much, Nikysha. It's been a long road passing all of these different regulations over the years, and we are glad that you've been there with us the entire time. There are a few questions here. First, have the merchants been complying with the new menthol ban? And has the Boston Tobacco Control Program and or the Boston Public Health Commission developed any new measures to track the impact of the menthol ban in Boston, specifically by race and zip code?
Sure. So I'll answer the second question first. So unfortunately, because this menthol ban really came, right in the middle of COVID, so this was June 1st, we have not really been able to do a bunch of enforcement. So anytime that we receive complaints, we're definitely going out. We're going out doing a lot of education, but as far as us going out and really, really hitting the pavement, doing a lot of the enforcement work that we typically do, that has been a little bit limited right now. But I do, expect that, in the coming weeks and months, as we start getting out there more, we will start to collect a lot more data about, what that impact really looks like. And the first question was about the enforcement.
Have merchants been complying with the menthol ban?
Have they been complying? So I have not received a ton of complaints. So typically, anytime that a new regulation comes out, I will start getting a lot of complaints. Not surprisingly, but I'll start getting a lot of complaints from retailers that are in compliance that are upset about, their competitor that is still continuing to sell products. But what I am hearing, so we have constant contact with a lot of these retailers. What I'm hearing is that these stores are not selling, but we do know is that there are a lot of people that are taking some weekend trips up to New Hampshire or down to Rhode Island, and we're hearing, or I'm even seeing just even on my own threads, people that are selling, personally selling some products that they were able to purchase out of state. So that is an issue that we knew, would arise. And actually I was on a phone call with DPH today, and we're actually going to be working with some of our neighboring states. So looking at working with New Hampshire and Connecticut and Rhode Island to try to get them to align their regulations with us, which will really help in, just those out-of-state sales.
Thank you. And 51 establishments selling tobacco in 0 to 124, that number is pretty high.
It is, but it was a lot higher a couple of years ago. And I mean, I really think that, as I mentioned, just from a year ago, we are down, almost 100 stores. And I expect to see these numbers really decrease. The more and more that we restrict and the less products that retailers are able to sell, tobacco products, the less tobacco retailers that we're seeing. So I think we are in a good place, and I think that those numbers will really start to continue to go down.
And we'll continue to work with you. Thank you so much, Nikysha. Okay, moving along in the agenda, we will now hear from Keshler Sanon, one of our Bold Teens. He'll tell us about some of the Bold Teens efforts. If you're not familiar, the Bold Teens are a youth-led organization that focuses on social and environmental justice. Take it away, Keshler.
Hello, everyone. So I wanted to start off with introducing the current Bold Teens that we have on the call. So if you guys could just introduce yourselves first.
Okay, well, I guess I'll start. I'm Treasure, and like this is my first year working with them, so I was really excited to be a part of this.
Pretty much what we've been doing lately is just helping out with the farmers market. It's been surprisingly busy, even though there's been a lot going on. The biggest thing that we usually work on is our efforts against tobacco and cigarettes and all those products. Keisha said a lot, and she summed up a lot of what I was gonna. She said a lot of what I was gonna say, basically. And so, basically, a year ago, last summer, we had a forum where different people met, smokers who quit, current smokers, youth, and we had talked about menthol and vaping, and now, zooming past all the way to 2020, June 1st of 2020, menthol and other flavored tobacco products were banned in Massachusetts. So, it's been a great year, and I just want to thank everyone who helped out. So, yeah. Any questions about anything that we've been doing?
Well, one thing that I would like to just encourage you guys to do is, if you are seeing menthol products in the stores, or if you're hearing about it, or if you're hearing about people selling singles or whatever it is, please, just let us know about it, and we will, that's something that we're always interested in knowing about, so that we, can make sure that these retailers are in compliance.
Thank you so much, Keshler, for your leadership. Thank you as well to Bold Teens. It's so important to have teens on the front lines advocating to our elected officials to really do their job, to protect our communities, to protect our young people, and to really protect all of us from the tobacco industry and other industries that are creating dangerous and deadly products that harm our families. This effort wasn't just a community effort. Our elected officials in the State House to create this menthol ban at the state level really worked hard and pushed to do something unprecedented. It just hadn't been done before. Every time we passed a different regulation that Nikysha mentioned, there was always a lobbyist saying, but don't include menthol, don't include menthol. And so we were finally able to get menthol included. So I want to take a minute to just thank one of our state representatives, Rep. Russell Holmes. He was definitely a leader in getting this menthol ban here in Massachusetts. And I just want to invite him to just share the importance of working on policy and addressing health inequities in our community and policies like this one.
So thank you, Cynthia. Thank you to the entire Codman Square Neighborhood Association and Council. I am very pleased to hear that all of the success, but like you said, it's not an overnight effort. It is a long challenge. And I can just tell you, just from the conversation I've heard today, some of the things that I'm reminded. I'm reminded of how even through COVID here, how much we heard from all of the small businesses who said, wait a minute, we're down big in our businesses already, and now you're going to still put this ban on us. You're going to essentially drive us out of business. And so it was just a reminder that even though we started this in June, there is another portion always on the other side that says, hey, we're being pushed to drive us out of business. And I'm being pushed whenever I get those calls to say, aren't there other things that you can sell? Are there other things that you can sell that are healthy and can still be profitable? And then two, I just want to talk about you, Cynthia, did not talk much about what you've done, but certainly you want to elevate the Bold Teens, but I can tell you all the teamwork that you did to build the folks at the State House to come and give you a press conference and have advocacy around this issue for why it made us all be able to be strong, that is in the Black and Latino caucus, to say, if we're going to go after this challenge around vaping, so because so much of the conversation was around vaping, what we kept hearing was, if we remove menthol from vapes, then what will the traditional menthol smoker be able to roll over to as they go towards cessation? And so the caucus said, wait a minute, that's a very good question. And then we got to, why don't we just remove menthol, period? I don't think they ever imagined that would be what our next step would be, because we thought, I'm sure they thought it was pretty logical. You have to have menthol if you want to get someone off of the cigarette itself. And the caucus was unanimous. And then for those who don't know, the Black and Latino caucus is not only Boston, but it's Springfield, Holyoke, Lawrence, Haverhill, other places where we have members. And we were unanimous when we went to the speaker about vaping, but also saying we're going to stand strong, that we want to, of course, see the advertisement, see what we've seen for advertisement from 50, 60 years ago about how they target Black and Latino communities. And literally, on my wall today is still an advertisement of the cool cigarettes from 50, 60 years ago, and the advertisement that was happening with Juul. And it was just amazing how those two things still look and who they're targeting. And so we went to the speaker, Senate president, and said, we think that this is the right thing to do. And so now, one of the other things I heard today was about, well, what happens when we go to other states and people come back and sell loosies or things of that nature. And I've heard a lot of people also talk about how it was horrible for all the amount of revenue we're going to lose, because that's been reported now, how much has been lost in revenue. And still, the Black and Latino caucus, our position has been, yes, we get some revenue on the front, but there's an enormous amount of healthcare costs and mass health that is not even close to what the small revenue is. So we think of, you think about it, how much, yes, people pay taxes over their 20 years, 30 years of smoking, but in that last year, 2 years, that it cost us to make sure that that smoker stays alive for that last year or two, it is unreasonable and certainly not worth us saying, yes, we're okay getting the money. So even when folks give us that argument, it still is not a valid argument. And so clearly, as you heard from the numbers from COVID and everything else, it is just one other problem, a comorbidity that we would have when it comes to COVID, and it's clear that we've made the right decision. So I don't think that decision is going to move, and I continue to appreciate your advocacy, both teams' advocacy around smoking in the city of Boston. That did help an awful lot, that we banned menthol before. I mean, if we can ban it in Boston, essentially we can ban it in the state, is definitely the mantra that we were running with. And I just ask you continue to put that in front of us, and we'll continue to be responsive.
Thank you, Rep. Holmes. We appreciate your leadership. We do a lot of work, at the grassroots level, but we need elected officials that will listen to us, hear us, do their research, look at the numbers, and do what's right to save lives and do what makes sense. So we're grateful for you. Thank you so much.
Thank you.
Excellent. Moving along in the agenda, we would like to take a quick minute and highlight our efforts to address the food options available in our community by sharing just one story of many. Let's quickly talk about the proposed Popeyes in Codman Square. Just brief history, our first presentation from the Popeyes team was in June of 2016. Residents' concerns were and continue to be that there were too many fast food establishments within walking distance of the proposed site. We've heard a lot of that from Joanna. Not wanting more unhealthy food options, knowing the existing health inequities in our community, including obesity and diabetes type 2, and the fast food chains' disregard for process in this particular situation. If you don't know, after its building application was denied by the Zoning Board of Appeal and opposed by the community, Popeyes responded by altering its permit application and proposing that kind of unrealistic takeout forecasts with their new application, meaning that they applied for a permit for takeout predictions that were less than what it would actually be, in our opinion, and ultimately was able to build out its space as of right because of that decision. The Boston Licensing Board reviewed the applicant's license application in April of 2018 and denied it. Popeyes responded with a lawsuit suing the Boston Licensing Board in 2019, and then once again applied for a license. We were relieved when the Boston Licensing Board once again denied the applicant's license in 2019. It has been a struggle of more than 3 years as we try to reduce the unhealthy food options in our community to leave room for healthier food options. And we know we have to continue this struggle year after year. So it's important to better understand the Boston Licensing Board's review process and learn ways to help increase healthy food options in our community. Before I introduce Commissioner Joyce of the Boston Licensing Board, I want to thank her and thank her team for its leadership on this Popeyes matter. We understand that the community may provide input when they have their hearings, but ultimately the board has to review these applications and other circumstances in order to come to a decision. On this matter in particular, we believe the board made the right decision and has helped to save lives in our community. We thank you, and we want to learn more about the Boston Licensing Board's review process. So without further delay, let's hear from Commissioner Joyce of the Boston Licensing Board.
Thank you. Good evening to the Codman Square community, and thank you, Cynthia. I am pleased to be able to join you here tonight to talk about our process with the Licensing Board. Let me begin by saying I was not chair of the Licensing Board when Popeyes first became before the board. I've been in this position since October 2018, and I did vote against Popeyes the second time it came before the board. So I am familiar with the process, and I do have some insight into what happened. Excuse me, I was asked tonight to talk about applying for a license in general, and also to explain what we're doing right now with the outside dining. I appreciate the community's concerns about bringing in new and different licensees and restaurants to your neighborhood. I think that's very important, and it goes to the quality of life in your neighborhood. The process is a lot simpler than I think people realize. Boiled down, you fill out an application, you schedule a meeting with the Mayor's Office of Neighborhood Services. We have a hearing before the Licensing Board. If the license is approved, it goes to the state for review and approval. If the state approves it, it comes back to us for the issuance of a license. We are open and operating, and we're continuing to have public hearings on a regular basis. And I'm trying to boil down the process to demystify what people think is a very high entry or a high barrier into owning a liquor license or owning a restaurant that serves alcohol and food in your community. So it's important to note the number of available alcohol licenses in Boston is capped by the state legislature. The city of Boston successfully petitioned the state legislature in 2006 and 2014 to increase the number of liquor licenses by adding what we call a neighborhood restricted license, meaning that these licenses cannot be sold or transferred. They have zero value, and they revert back to the board upon closure. So if a member of your community was interested in taking, in applying for a license, we do have, most times, these what we call neighborhood restricted licenses available for someone. This gives someone an opportunity to take that risk that they may not otherwise be able to go buy a liquor license on the open market. So the 2014 restricted licenses must be issued to the same neighborhood to which they were originally issued. So a Common Square license, if there was one, that is a 2014 restricted license. If that business for some reason closed, that license would remain in Common Square. The 2006 licenses have a broader scope. They don't have the same requirement. And the availability of these licenses, of these restricted licenses, is fluid. On occasion, they are returned to the board. And an individual interested in these licenses or in an alcohol beverage license is encouraged to apply. And now with COVID-19, we expect some of these places that were not able to sustain business during the pandemic, some of these licenses may be coming back to the board. We won't know that information until January, but it's interesting. And I always encourage people, someone who has an idea and the means to open up, if you're interested in a liquor license, contact our staff. We're always there to help you with the process. So at the public hearing before the board determines if there is a public need for the license and the proposed operation at that specific location. And that is the key. And that is what, that legal analysis is what we discussed when Popeyes was not granted a license. In determining public need, the board looks to community support or opposition, quality of life issues such as traffic, parking, and safety. And this is the key part, the number and nature of existing establishments with that type of license in the immediate area. And I would call that the saturation of that particular type of license. And that's what happened with Popeyes. The board determined there was a saturation of that type of license in that neighborhood. If the board does find that there's a public need, they turn to the question of whether or not there's a license available. If a license is available, the board will vote to grant the license, will vote to grant the request, and then the application gets forwarded to the ABCC, the state agency, for their review. If there is not a license available for the board to issue, we can defer the vote for up to 30 days to see if a license does become available. And as I had said earlier, we are always here to assist any applicant in the process. We'd like to see neighborhoods get activated, and we'd like to see these new concepts come before us. It just shows that our city and our neighborhood is alive and thriving. So the process for applying for what we call a common victualler license, which means no alcohol, if they're looking to open up in a previously licensed location and is not seeking any changes to hours or the capacity, we don't even require a hearing before the board. We can administratively approve that by the board. If the applicant is applying for a new location or is proposing changes to the application, that does require a hearing before the board in a complete community process. And that's the reason. We want to make sure the community is okay with perhaps longer hours. If you had a coffee shop that only opened up till 3 o'clock in the afternoon and a new operator wants to come in but they're proposing to stay open to 8 o'clock at night, it's important for us to hear from the community. We look at similar factors when we grant an alcohol beverage license. We look to the health and welfare of the community and the potential negative impacts on the same by the proposed offerings. And that is where the court affirmed our decision in Popeyes. And lastly, just to talk for a few minutes about, unfortunately, I don't have the number of licenses in Codman Square. I know the earlier slide that showed a lot of the restaurants you had, I assume that's accurate, but I can get back to this group with some more information. But as far as our outdoor dining, which you've seen across the city since COVID-19 has hit us, we streamlined what was a more robust process to allow these restaurants a chance to open up and to get back on their feet. And what that means is we created about 11 pages of guidance from all different city departments, and we put the onus on the licensee to abide by those guidelines. All you have to do if you're a restaurant right now, and you're interested in these temporary extensions, is to fill out our questionnaire on our website, submit a site plan, it can be hand-drawn, a health, safety, and operations plan, and photographs of the extension space, and give us proof of your legal right to occupy the space. A lot of these are on the public way, parking lanes. We don't have enough staff to go out and inspect all of these, so we're really going back and forth over email with the licensees to make sure they're operating in a safe manner. And we asked that they abide by the state guidelines. So some things in general about operating right now under the COVID-19 restrictions. We are not approving entertainment on these outdoor extensions, again, because we have kind of skirted the community process in order to allow these licensees to get back up on their feet. And we do, in something like music or even background music, it would be something that would require community process. Again, these have been granted in a non-precedent setting basis. There's no plans to extend them right now to next year. And we have the ability to amend them or rescind them at any time at our discretion should, for example, the neighbors complain that they're not operating safely. All restaurant staff must wear masks at all times. Tables must be 6 feet apart and no more than six people at a table. And the seating areas must be enclosed by approved barriers. Each restaurant must abide by the state's guidance and the COVID-19 checklists. And for these outdoor extensions that have not had the complete process, they can operate Sunday to Thursday until 10 p.m. and Friday and Saturday until 11. And right now we're in phase 3, step 1, which means we have no live entertainment is permitted. And we're waiting to see what the state does as far as phase 3, step 2. And we're doing what we can to help these restaurants out. You might be aware that these restaurants can now sell beer, wine, and mixed drinks to go. And we're continuing to work with the restaurants to see how we can assist them. It's a treacherous time for them, and we appreciate the fact that they're doing everything they can. And I'm happy to say that is the number of outdoor extensions we've approved in the last 2 months, the number of complaints have been minimal. I think everyone's trying to really be a good actor, and the neighbors and the community have been really understanding. So I'm happy to answer questions about the outdoor dining or about our process in general.
Thank you so much, Commissioner. We appreciate your presentation and being on this call this evening. We have a few questions here. The first, we don't have a lot of establishments that have indoor seating. That's one of our problems. Is it a requirement to have indoor seating in order to apply for the outdoor extension?
No, it's not.
Great. Stephanie, did you have a question?
I did. I have a question here about the hearings. As long as you can hear me. Can you hear me?
Yep, I can hear you. Go ahead, Stephanie.
Okay. So for the virtual hearings, has the attendance increased at all?
It's increased a lot with the remote hearings. I think because people can join us just by logging on at home.
That's good to hear, because one of the issues we've had is that our residents, our young people are very active, but they're in school during the hearings, or a lot of our residents can't get to the hearings in the middle of the day, but they can sneak off and attend a Zoom meeting sometimes, you know.
And I want to remind people, we do read all of the written testimony that's submitted. So we don't give any more weight to people who have joined us in person versus people who have submitted their testimony in writing. And I can reassure you that we do review everything.
That is definitely reassuring. Thank you. A question regarding applicants in Codman Square. Knowing a little bit more about the review process, and certain things may or may not change with certain applications, is it the practice of the licensing board that each applicant will have the opportunity to reapply every year, even if they were denied, and even if nothing in the application has changed?
Yes, yes.
And the last question.
And let me just say, the reason could be that the neighborhood could have changed. So their application might take on a whole different concept due to the fact that things around them have changed.
Understood. And the last question we have here is, we've seen the Boston Public Health Commission's data on the health inequities in our community, especially among Black residents. We're also aware of Mayor Walsh's executive order declaring racism an emergency and public health crisis in the city of Boston. Do you have any thoughts on what can be done in 2020 to address the number of unhealthy food licenses disproportionately distributed in communities like ours?
We are definitely looking at this through the lens of equities, of all sorts of equities. And I think we take a really hard look at fast food restaurants. And this is a perfect example of what happened in your neighborhood. And not to talk about other neighborhoods, but recently we did approve a fast food license in a neighborhood because there wasn't a single fast food restaurant within a 1 mile radius. And some people wanted that option. So we do look at that and we weigh it. And the community spoke up very loudly through the entire 2 years that Popeyes was trying to get into the neighborhood, that they weren't interested in it for the reasons that there was not a lot of other healthy options for them. So we do take that into consideration.
Thank you. This was very helpful, very insightful. We look forward to working with you in the future. You'll get many letters of support or opposition from the Codman Square Neighborhood Council and the bold teams moving forward. And we thank you for clarity, and hopefully if we have any other questions, we can ask the board. And
yes.
Excellent. Thank you. Moving along in the agenda, we will now hear from Shamara Rhodes, the Codman Square Farmers Market Manager.
Hello, everybody. Can you hear me? Can you
Yeah.
hear me? Oh, that's okay. I'm going to share my screen.
Let me just make you a host.
Okay. I'll just start off. Hello to the Codman Square community. My name is Shamara Rhodes, and I'm the host now, the Codman Square Farmers Market Manager. This is last Saturday, so I'll just have back on talking. We created the Codman Square Farm Market in 2008 to bring fresh, local, organic produce to a community saturated with unhealthy food options. As previously stated before, the Popeyes around the corner. We have McDonald's right there, then KFC down the street, and it continues. In our 13th year, we continue to assist families in improving eating habits and providing healthier food options in the community. Our farms are committed to our mission to address the obesity and diabetes, type 2 health inequities our community faces. You see Keshler, he just waved, and our bold teams. And even during this pandemic, our vendors, our boat teams, the volunteers, everyone has just been committed to coming to the park. We are open at 11 a.m., but there's honestly people lined up at 9 a.m. when Sean, that's from Riverdale, when Sean first pulls up, and it's amazing to see. Unfortunately, we do have to have people wait until 11, so sometimes people will go buy food and then come back at 11 o'clock, and then they're standing there waiting in line. We invite you to join us, visit us on Facebook and Instagram, and definitely tell everybody to spread the word, and definitely come see us, bring us some water. It's been getting hot, and I think Keshler can agree. Make sure it's ice cold for us. We don't like to complain or brag or anything like that, but we will take a request of it being cold on a Saturday. But if there's any questions, you see that's our line right there. And this is just last week. This is like how it's been since the market opened. I'm grateful that we do have access to Riverdale Farm, her farm, Oasis Farm on Baloo, which is right there on Norfolk, and that's run by Apollo and his team. It's been amazing to see that people, they want our products. Again, there's not a lot of healthy options in Dorchester area. We got so many corner stores, and I love our bodegas. I love them, but it's not a full stock of stuff they have. And you know, this is freshly picked. Sometimes you still see the little dirt on the carrots and everything like that. I think it's amazing. That's me telling somebody they can't take 2 gloves, but we definitely provide gloves, hand sanitizer. There's some snacks on the table for the customers. But again, if you have any questions, let me know. Yeah.
Thank you, Shamara. So this is an example of the farmers market under the COVID-19 guidelines. Usually our farmers market is full of social activities and events and fun and a lot of community organizing, but we appreciate you just taking lead and making sure we still have a farmers market despite all of the COVID-19 restrictions and guidelines, and making sure the staff, the volunteers, our young people, you, the customers, and the farms are all safe. So thank you.
They're passing out the census and some other forms, but rethink your drink. Yeah, that's good.
Maybe Keshler can just speak briefly on what rethink your drink is.
Rethink your drink is a hashtag that we have to try to get people to rethink their drink. So there's easy access to sugary drinks, and they're all like under $1. And it's very simple for like families under a strict budget or like teens to just grab at every bodega, every corner. So rethinking your drink is basically consider having water, consider having tea, something with low or no sugar in it, because type 2 diabetes is very prevalent in our community. So.
Thank you, Keshler. Thank you, Shamara. We will see you all on Saturday, 11 to 2 at the Codman Square Park. We invite you all to the Codman Square Farmers Market. We appreciate it.
So make sure everybody, every Saturday, sorry, Cynthia, every Saturday, if you're going to come there at 11 o'clock, make sure we have a coupon program. We are giving out $15 to the first 50 customers. I want to make sure to add that in. I'm so sorry. That's why that line is also so long every week. We have our bold teams counting. So we definitely like to provide and give resources. But if you want quick $15, make sure you're there. If you want to come at 10:55, that you're still not going to get in until 11 o'clock. I'm strict about the 11 o'clock rule. So that's it. But come get your free $15 of groceries from the farms.
Thank you, Shamara. Big thanks to the City of Boston Food Access Initiative and the Mass Farmers Markets for the coupon programs. Thank you, guys. Moving along in the agenda, we will now hear from Sergeant Dunford of C11 Boston Police Department. He'll let us know about public safety in Codman Square.
Good evening, Codman Square. Let's get right down to business. On July 23rd, we had a radio call for an armed robbery at 497 Walsh. A customer was in the the chiropractic rehab place, and someone came in and said, "Hey, somebody's stealing your scooter." He goes outside and indeed finds a young man attempting to steal his scooter. He confronts him. This young man has a fanny pack on. He backs up a little and takes out a gun and points it at him. The suspect then gets on the back of an ATV and leaves the scene. It was distinctive. It was white ATV. So officers from District 3 went looking for it. They found it at 94 Whitfield Street. There's a bunch of men in the yard. They saw the police looking at them. They all left the yard promptly, and the police went, took a look in the yard, found the fanny pack, felt it, could feel the gun inside, and that's that. So one gun off the street, and no one was hurt. Happy to see it. At 4 a.m. on July 31st, the Caribbean Market convenience store, I'm sure you all know it, it's at 558 Washington Street. At 4 a.m. we went by and found that the front windows were broken. Somebody had gone inside, they had stolen money, lottery tickets, cigarettes, sort of rifled through the place. We had it boarded up. The owner came out. We told him, obviously, we don't like this stuff. This was not a sophisticated or planned commercial robbery. This is an act of desperation. I would take it just by the lack of preparedness and the haphazard way they went about it. But I don't like that in the neighborhood at all. 510 Washington Street, we had officers saw two young men, one of whom they knew. They bumped into him the night before at the scene of a shooting. They saw him again tonight. The other man he was with was drinking out of a red Solo cup, world famous through any number of country music songs as actually containing beer. So they went up to have a conversation with him about drinking in public. They could smell it was beer. The young man who was drinking had a fanny pack on. Once again, they're becoming more and more popular. He said he had a license to carry a firearm and he was armed. So they separated these guys, gave it Pat. He did not have the license to carry with him. He had a gun on him. They went to Pat Frisk, the other man who they initially knew, and he also had a gun on him, but did not have a license to carry. So a little more investigation. They found out this young man did not actually have the license to carry as he claimed he did. So 2 guns off the street. Glad to see that. No one hurt. Now, one of you who cares very much about Wainwright Street in the park is always asking for more police presence. So we had some. This time, I'm deliberately not going to give you any details, but they were in the area of the park. They were low-profile officers. They saw someone approach the area, looking at their phone, looking around, looking a little lost. Most of you know that most people come to the park, know the park very well. So they were watching her. She met up with someone. They had a quick exchange in private. They went their separate ways, and they stopped and talked to her, and it turns out she had just bought crack cocaine. So they didn't arrest her. They gave her a summons for cooperating, and that investigation will continue. Now, Cynthia did ask me to come up with a comparison from 2019 to 2020 so far for Codman Square crime stats. So when I first got it, I saw the percentages. I said, oh my God, things are out of control. But then I looked at the actual numbers, and things are not out of control. Last year, we had 1 homicide. This year, we've had 0 in Codman Square. And you can't hear it, I'm knocking on my desk because I want 0. For robbery, we went from 2 to 4. Aggravated assaults, we went from 11 to 14. Commercial burglaries went from 0 to 3. Residential burglaries, 3 to 5. Larceny for motor vehicle, we went from 5 to 7. And larceny other, we went from 37 down to 24. For vehicle theft, we went from 3 to 7. I'll caution you that we did a study, and over half of the vehicle thefts we have in C11 are because the keys are left in the car and it's running. Very frustrating trying to get in front of that. So please always remember, if you're going to run into the store, shut your car, lock the doors, please. So that's what I've got for you guys. What questions do you have for me? Cynthia, you're down.
Thank you, Sergeant Dunford. We appreciate your report. Public safety and violence prevention are definitely public health issues. So we thank you for your leadership in Codman Square and keeping us informed. And last but not least, we have Roudnie from the Mayor's Office of Neighborhood Services. She's our community liaison, and she'll give us an update on what's happening in the Mayor's office.
It's gotten dark since, so I hope you can see me properly.
We can.
Hi, everyone. My name is Célestin from the Mayor's Office of Neighborhood Services, and these are my updates. I'm one of your liaisons for Codman Square, and I'll get right into my updates. So City Hall is now open 3 days instead of 2. We're open Tuesdays, Thursdays, and Fridays from 9 a.m. to 4 p.m. depending on the department. But your best bet is to call 311 and figure out which department you're coming to work with and whether they're working on an appointment only model, or if they're still having people come in for in-person visits. So Tuesdays, Thursdays, and Fridays, City Hall's open 9 to 4 p.m. Mobile testing sites. BPHC gave a great presentation earlier on on COVID, and she touched on testing sites, but you do have to know that these testing sites, it's very important for everyone to know you do not need symptoms anymore to go to these testing sites. You do not need to have insurance. You can go up and say you just want to get tested and they will test you. If you offer your insurance card, they will bill it. But if you do not offer it, I believe that they will still test you. Do you need to make an appointment? No. Their mobile testing sites, for example, when they had it at Jubilee, you would just drive into the lot, you park your car, and you get in line, and they do your intake, and they put you in a queue, and then you go up and you get tested, and you get your results within 3 to 7 business days. At least that was my experience. I got tested at the Codman site. It was fast, easy. I was in and out of there within 20 minutes. So next testing is happening in Codman on Wednesday the 5th. Codman Park, you would just walk up to the park, you get in line, and they would test you. So what I'm going to do is I have a flyer with all the locations and dates running all the way through August. I will share that on the Codman Square Council Facebook page so everyone has access to it. A very hot topic in the city of Boston right now is about the BPS reopening. And so I don't have all the answers, and we don't have yet a model that we're sticking with. However, I do want to give you a family helpline that you can call if you have questions, Monday through Friday from 9 to 5. And it is 617-635-8873. We do have the main lines for BPS, but I think this one is specifically for the families who are struggling with the reopening right now. 617-635-8873. And they do have support in multiple languages. So if you call and you speak Spanish or Cantonese, you just say your language name, and anywhere in the city of Boston, they will call an interpreter to help you. Second thing is, which I just discovered and I think is great, the Boston Workforce Development Office is hosting Boston Employer Forum Series. And I think it's great just because it's going to help employers understand our research that we've done and how to, it's basically, I'll read what it says, to better help colleagues in job training programs prepare the participants for COVID era workforce. So basically, after COVID, how are these different fields going to be impacted? They had on July 30th for healthcare. The next one is on August 5th for hospitality. And the last one is on September 1st for construction. As we know, this area, we have a ton of construction workers. And so if you want to participate as an employer or employee, you should go to owd.boston.gov. So that's Office of Work Development.boston.gov. So I do want to make sure when I come to these meetings, we don't press enough on the different services that we usually offer that are still being offered, because a lot of these communities are being impacted very hard by this pandemic. Recovery services are still being offered. If you visit boston.gov/recovery, you can get all the resources. And one of the new things we're doing in the city is setting up comfort stations that have bathrooms, hand washing stations, and Narcan for people who are who are going, for addicts who may be using this comfort station. And we also are still offering services to veterans. You can call 617-241-VETS or call 311. They will connect you to these services. We are still offering disability services. Very recently, we connected a family with the Disabilities Commission from things like getting a placard. Are we ticketing for placards? We are not ticketing for expired placards, but right now they're only accepting applications for new placards via mail. So if you need more information, just call 311 and they will connect you with the Disabilities Commission for anything you need. Another update that's important, street sweeping. As we know, we weren't towing or ticketing before, but now, starting August 10th, we will be ticketing. The ticket is $90. That ticket was raised. So street sweeping, we will not be towing right now, but we will be ticketing the $90 increased ticket fee just to deter people from staying on the street. Another update, mail-in ballots, very, very important. And I made it one of my last updates just so it sticks, hopefully. If you are already registered to vote in the city of Boston, you will get a mail-in ballot to your home. But if you are not, these are important days for you to remember for your registration. Wednesday, August 26th is your deadline for your state primaries. And August 28th is your deadline for general elections. So if you want to register to get your mail-in ballots and you have not yet, you can go to boston.gov/elections. And you should know that the elections department is one of these departments running on an appointment only basis. So I'm sure a lot of this you can get done online or by calling us, and we'll hook you up with someone who can help you do it. With that being said, very lastly, my abutters meetings are going to start soon again. We're going to host them virtually. And if you want to be prepared in case you're planning on attending any of these virtual meetings, you should download the Cisco WebEx app. I know we use Zoom a lot and Google Meet. Cisco WebEx is our vendor for the city of Boston, and I want you to be prepared should one of these meetings come and get familiar with it. So Cisco WebEx is our platform. If you have any questions for me, Cynthia, thank you for having me, and a good night to the Codman community. I forgot to say that.
Thank you, Roudnie. We have a question here. Some of our seniors are asking, is it a requirement to vote by mail? Will they still be able to vote in person?
Good question. Thank you for catching that. You will still have 100% access to your local voting polls. That's just another option in facing COVID that we're giving you so that you don't have to go out to perform your civic duty. You can mail it in too. But yes, you have 100% access to your same voting poll. Thank you for that.
No problem. And in the event that you do register for vote by mail, can you still vote in person instead?
That's a very good question. I'm not sure. I can follow up with elections on my end, and then you can help me by calling 311 and get connected in the meantime.
Excellent. Any other questions, Stephanie?
Hi, I had a question here for you about just everything going on with reopening schools. There's been a conflict, or there's been conflicting things going on with like the city, with the Boston Teachers Union, pitting teachers against parents and all of that. And I was just wondering how you guys are working with the Teachers Union and teachers to kind of make decisions.
I think that's a wonderful question. And I'm going to put all my faith in my colleagues at the Boston Public School Department, but I cannot answer that question. I'm not too sure about the exact, the technical workings of them working with the union and the teachers. I know very recently the teachers striked out in front of City Hall with the nurses, to express their voices and not wanting schools to be open. And right now we're playing with two models. We have a hybrid model. That means we would do half online and half in class. So we would split the class on a Monday, Tuesday, Wednesday we clean, and Tuesday, Thursday. So the teacher would split their rosters in half and have half of the kids online and half of the kids in person. And another model is what we've been doing is the all remote model where everything would be online. So right now on the 28th, the superintendent Brenda Casilius presented a draft, and there's a lot of feedback on the draft, and they're going back and forth right now to see how can the teachers accommodate and what works best. Remember, we also have to accommodate students with special needs, and we do things like we deliver food to them. We use a lot of the school buses to kind of deliver food to the kids with special needs, and now it's the time for us to come to the reality of school is starting back up. What is the best model to make sure that our kids are adequately educated and also being kept safe? Because you can tell like the kids are gonna need that physical, that one-on-one, and it's how do you make sure that they're being safe while giving them that? So I will find out for you about the workings between the union and BPS. Thank you.
Thank you very much.
Thank you.
Appreciate all of your updates. On that note, I want to thank all of our speakers for joining our call this evening and sharing the important information that the residents of Codman Square need to hear. I want to encourage all of you to share this meeting with your friends, your family, your neighbors. I want to thank all of you for watching and for listening, and I will see you all next month, same time, same place. Have a good night.